All in all, I've thoroughly enjoyed my time studying at QUT, and every subject has provided multiple different aspects of new information for me. This capstone unit in particular has left a marking bits of information that I know will stay at the front of my mind throughout my career. Thank you for everything. Hi, my name is Alex Smith, and I'm currently in my final year of study, about to graduate with a bachelor's degree in nursing and paramedic science. With this graduation date fast approaching, it is important to consider what parts of my degree will remain relevant throughout my career. This unit has run through multiple vital aspects of professional practice, and today I am going to select one of the 8 reviewed in my written reflection and explore it in depth in this oral presentation. The specific point I have chosen is evidence-based practice and how it will impact and remain relevant to my future career as a practicing paramedic. Evidence-based practice is a vital part of any medical practice and is a component of which I'm sure will remain important to me through my practice as a paramedic. Evidence-based practice is simply when a medical professional bases their decisions in practice on evidence from clinical studies and sources. Sackett, Richardson, Rosenberg, and Haynes defined it as the conscientious, explicit, and judicious use of current best evidence in decision-making about the care of the individual patient. This implies that the decisions I make for my patient whilst I am a practicing paramedic will be based on recent and accurate evidence for the individual case of my patient. According to Nevo and Sloven-Nevo, evidence-based practice has grown in popularity since its origination, and since has been relied on to deliver both professional and ethical practice since. This source also adds that evidence-based practice does not involve individual practitioners carrying out their own studies, rather relying on evidence gathered in existing relevant studies. The vitality and importance of research in pre-hospital care has been recognized through its help in recognizing, deciding, and instilling new changes and maintaining current practice depending on the effectiveness and efficiency of the options. It is often referred to as the scientific method, as it revolves around evidence gained from trials to gain data which supports treatment methods in order to construct a treatment option, which will have the best result for patients. Therefore, evidence-based practice is relevant to a practicing paramedic, as it will allow the paramedic to not only know why they are performing certain interventions, but also know that it is the best option for the patient and will facilitate best practice. There are 5 steps to performing evidence-based practice. According to Rubin, these 5 steps are formulating a practice question, searching for best evidence, appraising the evidence, applying the results, and evaluating. Formulating the practice question involves conversion of information requirements into a specific question. This question should be able to guide a search of studies to provide the evidence. For example, in my practice, I may need to know which is the most effective opioid. Thus, my question would be, does the use of morphine produce less or less severe adverse reactions than fentanyl? Searching for best evidence is merely the application of the question into reliable databases such as Cochrane and PubMed. Appraising the evidence is a key step in determining the accuracy and relevance of the data acquired. If this is not done right, it can lead to one of the major disadvantages of evidence-based practice. For example, in my practice, I would need to go through each source of evidence I use and analyze the bias, whether random or controlled. And the higher the bias, then the less reliable the source. Applying the results does exactly what it says on the tin. This step simply involves putting into practice the evidence learned from the research and apply it for each individual patient. For instance, the primary use of the more effective and efficient opioid for pain relief for different patients. Finally, The effectiveness and efficiency of the applied intervention needs to be evaluated as to whether it is truly the best option. This can be done through many practical trials or assessments. Evidence-based practice, although it is a useful tool and a vital aspect of paramedic practice, has its flaws. Rubin detailed 4 disadvantages of evidence-based practice and its flaws in realistic practice. These disadvantages are that it is too mechanistic, it is sometimes unclear and ignores research flaws, it is difficult to implement due to limited resources, and finally, it is difficult for sources to be relevant. Evidence-based practice relies on studies, often causing it to be mechanistic. This means that it fails to address the individuality and uniqueness of patients en route. For example, one patient might be on existing medication or have medical conditions that would make the use of certain treatments or drugs unwise for the patient's well-being. Such as, you would not give every patient aspirin or GTN who is complaining of chest pain. Research flaws are a big factor in the disadvantages of evidence-based practice. This is because it is easy for sources to edit data and results, as well as make the survey bias. This can be done through giving differing amounts of the control and intervention drugs, or having too many differences between both the control and intervention groups. For example, if you were testing the effectiveness of a new opioid and the control group were IV drug users or opioid-dependent patients, the results would favour the intervention group or the new opioid. The implementation of evidence-based practices is limited by the resources at hand. For example, it is difficult to bring in a new piece of equipment for leg fractures, as they do not only need a set for every different ambulance for the entire QAS, but also every staff employed by the QAS is required training on its use. Evidence-based practice is only useful if it is relevant. This brings me to my final disadvantage. It is a timely process bringing in and including new treatment methods into large services such as the Queensland Ambulance Service. This process can often take years, by which time there will be more relevant data on the use of certain treatment methods, rendering the original methods useless and void. It is because of this evidence-based practice works best when combined with experiential knowledge. This provides an extremely useful combination of knowledge aspects which results in best practice. In conclusion, I would like to reflect on what I've learned through evidence-based practice. It, in total, will remain relevant throughout my career. This will be done through its constant use to allow me to deliver the best care on the most accurate information. However, it is important that I keep in mind the flaws involved. If I do not acknowledge these flaws, then this will result in a lesser practice for my patients. Who am I? Where am I going? What am I going to do with the rest of my life? These were questions I asked myself all through my high school, and it has become an important part of my time at uni to reflect on what I have learned in order to apply it in the best way possible.